Hello everyone and welcome to today's webinar on Education Implementation, Teams, and RRT MET Alert Criteria. Only about 20% of the individuals who have cardiac arrest inside a hospital will survive. This statistic prompted the development of a cardiac arrest system of care. 4 out of 5 individuals with cardiopulmonary arrest have changes in vital signs prior to the arrest. Therefore, most individuals who eventually have cardiac arrest show signs of impending cardiac arrest. Survival rates could be improved if individuals are identified and treated with ACLS protocols sooner. Originally, specialized groups of responders within a hospital called cardiac arrest teams attended to a patient with recognized cardiac arrest. These teams respond to a code blue after someone presumably recognized an active cardiac arrest and sought help. Many believed cardiac arrest teams would improve survival rates, but the results were disappointing. Studies show that the survival rates were the same in hospitals with cardiac arrest teams as those without a team. As a result, hospitals are replacing cardiac arrest teams with rapid response teams, or RRTs, or medical emergency teams, or METs. Rather than waiting for loss of consciousness and full cardiopulmonary arrest, RRTs or METs closely monitor patients in order to treat them before the cardiac arrest occurs. These teams combine the efforts of nurses, physicians, and family members to detect an impending cardiac arrest. RRT or MET alert criteria includes the threatened airway or labored breathing, altered mental status, bradycardia or less than 40 BPM or tachycardia greater than 100 BPM, a seizure, hypotension or symptomatic hypertension, sudden and large decrease in urine output. When hospitals implement RRTs or METs, there are fewer cardiac arrests, fewer ICU transfers, improved survival rates, and shorter length of inpatient stay. Don't forget, we offer online ACLS certification on our site. You can find a link in the description. We encourage you to become certified as soon as possible, whether that be on your own time with an online course or in an in-classroom setting. So thank you so much for tuning into today's webinar. We will catch you the next time.